Georgina. Welcome to Texila American University graduation program.
Thank you.
Georgina, what inspired you to pursue a PhD in public health and Texila American University?
Thank you very much for the question. I was inspired because I've done my master's and my basic. I've done a public health nursing, so I wanted to specialize in that area. And like others have said, I was working a mother, and I was happy because the program is flexible. I can go to work and come and study at my own will, and that inspired me a lot. Somebody introduced me to the program, and I was happy. Because I look back, and I look at other people who have done PhD, who have been to school with them. I said, why not? I can also do it. So when I got the program, I was happy, and I wrote, and I'm happy for where I am now.
Wonderful. That inspired you.
Yeah.
And why did you choose the Central University of Nicaragua for your PhD studies?
Yeah, because of the flexibility I talked about, and online I can do the course at my own will after work. I come home, and I think my country couldn't offer me that opportunity.
Right.
So I thought.
Understood. Right. And what advanced research or public health leadership skills did you gain from the program?
Yeah, I'll specialize in disease control, environmental health, and it's deepen my knowledge in all these areas, and public health management.
Right.
And I've assumed leadership position for about 3 institutions.
Right.
And doing my PhD, it gave me the confidence.
Right.
In my last position, it gave me the confidence to be able to work with every category of professional.
Right.
Because of the broad knowledge I have acquired in doing the PhD. And I've used that to inspire the young ones.
Correct.
So I think it has done a lot for me.
Absolutely. And do you have any specific experience, like in academic or research, that had a big impact on you?
Yeah, the research area. I did a case control study.
Okay.
My master's, I did a case control, and I improved on that, and it has helped me a lot to get a hands-on skill on case control study. Also with the environmental concept and community development. Yeah, I understand the concept now, and I can work in any capacity or any community that I find myself there. And the health financing, the project management has also broadened my knowledge, and I can sit around the table with every leader because of what I've gained.
Right. Wonderful. And how did Texila American University faculty assist you in your PhD journey?
It wasn't easy.
Okay.
I want to commend Georgina, who started with me. It's not easy. They've done very well, all the faculties, the supervisors, our mentors. They really had time for me because, as I said, I was working. They will whip you if you are delaying, and that was the hallmark for the university. And it's very good, and I commend all of them, and especially Georgina, who began with me and giving me the encouragement. Every day, every week, Georgina will send you a message. And that's something that inspired me. It got to a point I wanted to stop. I said no, I can make it.
Right.
And that's where I am now.
Right. And how is this PhD in helping you contribute to your public health improvement in Cameroon?
Yeah, academically, I'm going to teach, and I was at the clinical area, and I've used that to teach a lot.
Right.
And to mentor nurses and midwives, and I'm going to use this to teach for the rest of my life.
Right.
I'm going to teach at the university at a higher level based on the PhD I have.
Right.
Yes, so that is one thing that I've gained from Texila.
Wonderful. And what challenges did you face? I'm sure you have shared a lot of challenges who are going through the program. But anything that, during your studies or, face basically how the university been a help or support for you, other than you have already shared? Anything that comes to your mind?
When the COVID came, I started some years back. When the COVID came, it wasn't easy for us. I myself, I had COVID.
Right.
So it also affected my studies. That's why I had a delay and these are some of the challenges, but it all was surmountable and we were able to go through. So I'm happy for the patience you had for me to be able to go through.
Wonderful. And what message would you like to share for the aspiring PhD candidates?
Yeah, PhD, it's not difficult. People think PhD is difficult. If you are determined to get something in future, if you are determined to climb the ladder, then you have to do it. If you inspire the young ones, because it's a higher education, and once you have it, you are able to mentor the young ones. So for me, what I'll be happy is to not just have the certificate and sit down, to mentor the young, to grow them, to also become some leaders in future. And I think it will also help, once you give the knowledge to them, it will also improve on the clinical care, patient outcome, and other challenges.
Right. Thank you so much. Thank you so much for your feedback. It's been wonderful. Thanks so much once again, coming. Yeah.